Welcome back. Clinical psychologist, clinical hypnotherapist Krisnan Hurdle also shared his perspective on mental health and how people can start the healing process.
Mental health is one of those things that we have associated with persons being mad and crazy. And it's very, very important that we recognize, especially the onset of COVID and this pandemic, that mental health affects us in several ways. And so the idea of the stigma of mental health is not about persons who have these, what we referred to earlier as psychotic disorders, where they lose in touch with reality. But where you're stressed out, where you're overworked, you're burnt out, you are having difficulty sleeping, you're having anxiety, you're having difficulty thinking on the job. Stigma is real. Persons have certain connotations and associations with mental health and seeking out mental health services. But really, I work with from a family of a parliamentary representative to executives. I've worked with CEOs, general managers. I've worked with teachers. I've worked with other mental health professionals, and I've worked with children. So it doesn't have to be, so we must get away from the idea of mental illness and really look at how healthy am I doing? How am I functioning? How am I thinking? How am I doing emotionally? When people think about mental illness, we usually talk about people who are what we refer to as mad or gone off. Of course, we don't like to refer to that. We give them their technical name, psychotic or schizophrenic. And this is where the person has lost touch with reality, where they may be hearing voices, or they may be thinking that what people are doing to them might be affecting them in some way, but it is not. It's what we refer to as a delusion or hallucination. Either they're hearing something or they're having an interpretation of what is going on around them that might not fit in with reality. Their anxiety disorders, most of us hear about PTSD, panic attacks, maybe related to phobias, agoraphobia, going outside, fear of specific things, specific phobias. And then there's general anxiety, and persons may also have things like performance anxiety when they got to play a sport or whether they're in front of a camera or performing our exams. And then there are some disorders that are related to old age. So we're thinking of like not necessarily old age, but diminishing in the brain, like dementia, where persons tend to lose their memory and they're not able to be able to be in tune with the world as they're accustomed doing. There's depression, or depressive disorders, I should say. There's a range of those. Depressive disorders include things like major depression, where persons are unable to do the things which they're unmotivated to function, to do the things which they're accustomed to. They may be sleeping for long periods of time. They are not able to interact with the world as they used to. They tend to feel sad. They're crying, perhaps crying a lot. They are feeling like their life is hopeless. And many times with depression, people tend to feel suicidal. That's something that we probably look at. And just tend to be down feelings and not motivated to do things, and losing pleasure as well, losing pleasure for things that they're accustomed doing. You can also have issues with sleep, because there are also sleep disorders, but some tend to have issues with sleep as well as eating changes as well, diet changes. And then, of course, there are, as we mentioned, sleep disorders, insomnia, where persons struggle to get to sleep. They might be struggling to get to sleep. They might be struggling to waking up during the night and not being able to get back to sleep. There may be things like sleep paralysis, where they're having unable to move coming out of sleep or as they wake up. And then there are other childhood or developmental disorders like autism, Asperger's, where there's a defect in the brain, maybe because of birth or other events and early childhood events, and they're unable to interact as we say, within normal range as we're accustomed to knowing. So those are some of the range of mental disorders that we see on a regular basis. Any age group can be affected. So there are children, because we see mental disorders in very early development. And then you can go all the way up to, as we mentioned before, things like Alzheimer's and dementia into the latter years. When is a good time to see a psychologist? When you feel like you're overwhelmed, when you feel like you're not able to function in a way that is helping you to get through your day's activities, whether it is work, interacting with your family. So overwhelm could be anxiety. Overwhelm could be you are so high and so happy, and we're thinking of things like bipolar disorder and mood disorders. Or you're so low and depressed and you just can't function. Stress is one of those things that is a trigger or risk factor for many other situations. So whether you're overworked, whether you feel like you are unable to think clearly, you're having anxiety, whether it's panic attacks, or you're having the inability to some people have difficulty getting to work, or while they're at work, they're unable to function on the job. You're finding that you're having difficulty remembering things, or you just tend to be kind of foggy. Brain fog is something that affects people a lot, especially related to insomnia, some of the mental disorders specifically. But when you feel like you're overwhelmed, you're not able to function, do your regular day's activities, that's the time where you should really reach out for help. You can reach out on the behalf of someone else. So if you find that a family member is not functioning well, you can reach out, you can call psychiatric hospital or call one of the a therapist and reach out for help on their behalf. Of course, they must be willing to do it, but you can get the ball rolling. First of all, when a person is a harm to themselves or harm to someone else, that's the first stage of, the first sign that they need to be institutionalized. Whether it's health harm, cutting, beating themselves up, they might be threatening to commit suicide, so suicide thoughts, suicide ideations, suicide plans. And then, of course, if a person is a threat to someone else, whether they are threatening to harm someone else, of course, you can call the police or call the assessment unit at the psychiatric hospital to have some kind of intervention, or a community mental health officer. For the most part, the public is encouraged to contact the police if a person is a harm to someone else. You can also call the ambulance service for someone who is a harm to themselves, whether they want to commit suicide or they're self-harming. But we tend to first of all think of the police and the psychiatric hospital as the first steps of intervention. But if you want immediate advice, of course, you can speak to a mental health practitioner, a qualified mental health person, and they can advise accordingly. I am really, really proud and really, really honored when I have the opportunity to work with a male. It's very, very heartening that either he thinks he wants help and he's reaching out for help, or someone in his family has suggested it. Now, of course, in the process, the person will decide, do I want to continue this or do I not want to continue? But most of the time, there's a lot of ego involved with men and mental health issues. And it's the whole idea of feeling like you're weak and being vulnerable. Because that sense of ego tends to be so much stronger with men. And you tend not to want to see yourself as an very emotional person. There are the connotations of emotional being a weakness. Then they tend to avoid dealing with their feelings. They tend to avoid dealing with their past traumas, their past disappointments and failures. And that tends to cause them to go in a rut where they're not handling their situation well, where they're resorting to alcoholism and dependency, drug dependency, and even violence, because a lot of the emotions are being kept inside. They're not expressing them in healthy ways, and then they're choosing dysfunctional or deviant ways of expressing their emotions or just responding. Many times persons are at a stage where they can't control, they're responding, and then sometimes they go over a threshold where they're just reacting and responding automatically. So I always do encourage men to reach out for help. You're not weak if you're reaching out for help. In fact, the ability to push past a vulnerable stage is a point of strength. And I like to say to my men when I'm working with them, the ability to just like sports, when you have to push and you work out and you going through certain thresholds to reach that point of physical strength, to go through and push through these vulnerabilities and these difficult feelings, actually requires you to be strong. And the first point of strength is vulnerability. Whether you're submitting yourself to a trainer, you're submitting yourself to a coach, or you're submitting yourself to working alongside a mental health professional, it really is about strength. It really is about realizing that you are struggling and you need help, and that help is available to you. So see yourself as strong. Realize that there's a strength that comes from challenging your vulnerability. I think that the behaviors we are seeing nowadays definitely come from that point of not seeking help early enough. Many times they're indicators, and in early stages, persons are not paying attention to those indicators. Whether it is anger building up, it is the feeling of burnout, you're snapping at your family members, you are struggling, you're having difficulty sleeping. In some cases, it starts with waking up and not being able to get back to sleep. Other cases, you're struggling to get to sleep in the first instance. Or there is the issue where you tend to feel like, I am dealing with it my own way. And when they feel like they're dealing with it their own way, oftentimes they're really not doing anything. They're using that as an excuse to avoid getting help, to avoid reaching out for help. And then it builds up. And in some cases, it becomes a real significant disorder, severe disorder. And other cases, it leads to some kind of dysfunctional behavior, whether it's alcoholism or drug dependency or even domestic violence. I am aware that within our homes, within our schools, even within the mental health fraternity, most of our practitioners, most of our leaders are women. And, we tend to wonder sometimes, I think about the impact of the impact of growing up, being led and being trained and being socialized by a female-dominated society in some cases, or female-dominated organizations. And while this is not a conversation about feminism or those things, those issues, I definitely am concerned about the absence of men within our institutions. I'm concerned about the absence of men within our places of influence, whether it is the schools, whether it is our homes, or our mental health settings. And we definitely ought to encourage our women, definitely ought to encourage our men to be more involved. Even if there isn't one in the household, you can always try to kind of pull in or direct your young man to your son, your nephew, whatever the case is, to some kind of positive male influence. And additionally, I definitely would encourage all of us to not see mental health as, once again, as an illness, but to see it as a degree of wellness, where we are considering how well are we able to function, and how can we perhaps manage our conditions, manage our minds, our emotions, our thoughts, and even our behavior a lot better.